Lately, castor oil has been making rounds on social media, especially TikTok, as a supposed cancer cure. Some claim that simply applying it topically can help treat breast cancer. With so many people talking about it, it's no surprise that more and more questions are popping up about its actual benefits. But here's the reality. There is no scientific evidence that castor oil can fight cancer. Misinformation spreads fast online, which is why it's so important to have trustworthy sources to separate fact from fiction. A lot of registered doctors are spreading awareness by consistently warning patients that natural doesn't always mean safe. But with social media now a major way of spreading information, we should also remember, just because a video goes viral doesn't mean it's true. While it's FDA approved as a laxative, some viral posts claim it can do way more, like detox your liver, help with weight loss, and even shrink tumors. But is there any truth to these bold promises, or is it just another internet health fad? Let's break it down. According to Dr. Gabriel Lopez, director of MD Anderson's Integrative Medicine Center, there's absolutely no scientific evidence to back this up. Sure, castor oil has its legitimate uses, like relieving constipation or moisturizing the skin. But fighting cancer isn't one of them, whether you drink it or use it externally. In fact, if you're undergoing cancer treatment, applying castor oil to your skin could actually do more harm than good, especially if you've had surgery or radiation therapy, since it might cause irritation or sensitivity. Dr. Lopez stresses that before trying any alternative treatment, it's crucial to talk to your doctor. Some natural remedies may interfere with medications or treatments, and understanding the risks versus benefits is key. So, before you believe everything you see on social media, check in with your medical team. It's always better to be safe than sorry. First, let's understand the history behind this fake myth. Ancient Greek physicians like Hippocrates and Galen believed breast cancer was caused by an excess of black bile and used castor oil as a remedy. Fast forward to the 1920s, and there was renewed interest in castor oil packs as a way to expel tumors near the breast surface. And now, social media has brought castor oil back into the spotlight, once again promoting it as a natural breast cancer treatment, despite zero scientific evidence to support this claim. But what science actually says about castor oil? Laboratory and animal studies have found that it has antioxidant, anti-inflammatory, cytotoxic, and antimicrobial properties. That all sounds impressive, right? But here's the catch. None of these studies have been conducted on humans to prove any anti-cancer effects. While castor oil has shown some ability to slow down breast cancer cells in test tubes, that's very different from proving it works in real patients. One thing castor oil is scientifically proven to do is that it acts as a laxative. Its main component, ricinoleic acid, influences intestinal ion transport, water flux, and motility, which explains its use in colon cleansing. A meta-analysis of 6 studies with 701 patients found that castor oil increased the excretion rate, 92% in those who took it versus 73% in those who didn't, improving colon capsule endoscopy results. Researchers even suggested it could be useful in colon prep before a colonoscopy. Castor oil has also been tested in other medical applications. For instance, in one murine mouse model, it showed anti-tumor effects on body and ascites tumors. In another case, a topical preparation with castor oil helped accelerate wound healing after a radical mastectomy. But again, these effects don't mean castor oil cures cancer. It just highlights potential supportive benefits that need further research. Claims that it can shrink breast tumors or cure cancer are not supported by scientific research. If anything, it may help with bowel movements, wound healing, and inflammation. But that's a far cry from being an effective cancer treatment. More human studies are needed to truly understand its potential beyond its well-known laxative effects. But wait, there is a surprising role of castor oil in chemotherapy. When you think of castor oil, you probably picture it as a laxative or a home remedy for skin and hair care. But did you know it actually plays a role in chemotherapy? Not as a cancer-fighting agent itself, but as a carrier for certain powerful drugs. One of the most well-known chemotherapy drugs, Paclitaxel, isn't very soluble in water. That's a big problem because for it to be administered intravenously, it needs to dissolve properly. This is where a castor oil derivative, polyoxyethylated castor oil, also known as chromophore EL, comes into play. It helps paclitaxel dissolve, making it possible for doctors to deliver the drug into the bloodstream effectively. What is paclitaxel with castor oil derivative used for? Paclitaxel with polyoxyethylated castor oil is a chemotherapy drug used to treat several types of cancer. It's often prescribed alone or with other chemo drugs to fight breast cancer, ovarian cancer, and non-small cell lung cancer, NSCLC. It's also used for Kaposi's sarcoma, a rare cancer that causes abnormal skin patches and often affects people with AIDS. Paclitaxel belongs to a class of medications called antimicrotubule agents, which is a fancy way of saying that it prevents cancer cells from growing and spreading. In simple terms, it works by disrupting the internal skeleton of cancer cells, stopping them from dividing and multiplying. How is this medication given? Since paclitaxel is a strong chemotherapy drug, it's not something you take in pill form. Instead, it comes as a liquid that's slowly infused into your bloodstream through an IV. A doctor or nurse administers it in a hospital or clinic setting over a period of either 3 or 24 hours, depending on your treatment plan. The schedule varies depending on what type of cancer you're treating. In case of breast, ovarian, or lung cancer, it is usually given once every 3 weeks. While in Kaposi's sarcoma, it is given once every 2 or 3 weeks. Your doctor will closely monitor your response to the treatment. If you experience any serious side effects, they may adjust your dosage, pause, or even stop the treatment if necessary. That's why it's super important to keep your doctor updated on how you're feeling during treatment. Here are some important warnings about paclitaxel with castor oil derivative. If you or a loved one is undergoing chemotherapy with paclitaxel, formulated with polyoxyethylated castor oil, there are some serious risks you need to be aware of. That's why this medication can only be given in a hospital or medical facility, under the watchful eye of a doctor who specializes in chemotherapy treatments. Risk of low white blood cell count. One of the biggest concerns with paclitaxel is that it can drastically lower your white blood cell count. These are the cells that help fight infections. If your white blood cell count gets too low, your risk of developing a serious infection skyrockets. Before and during your treatment, your doctor will monitor your blood to ensure your levels are safe. But you also need to watch for signs of infection. If you experience fever above 100.4 degrees Fahrenheit, 38 degrees Celsius, sore throat or cough, chills, painful or frequent urination, call your doctor immediately. These could be signs of a dangerous infection. Serious allergic reactions. Take precautions. Paclitaxel with castor oil derivative can trigger severe allergic reactions, which is why you'll be given medications before each dose to reduce the risk. Even with these precautions, some people still experience reactions. If you notice rash, hives, or itching, swelling of your face, eyes, lips, tongue, or throat, difficulty breathing or swallowing, flushing, dizziness, or a fast heartbeat, seek immediate medical attention. This could be a life-threatening reaction. Stay on top of your medical appointments. Your doctor will schedule regular tests to monitor your body's response to the treatment. Make sure you don't skip any appointments. These checkups are crucial to ensure the medication is working safely and effectively. Paclitaxel is a powerful cancer-fighting drug, but it comes with serious risks. Always keep an open line of communication with your doctor. Report any side effects immediately, and never hesitate to ask questions. But let's be clear, castor oil itself has no cancer-fighting properties. It doesn't shrink tumors or kill cancer cells. It simply helps transport chemotherapy drugs into the body. In fact, some people may even have allergic reactions to the castor oil derivative used in chemotherapy, which is why doctors sometimes pre-medicate patients with antihistamines or steroids before giving them paclitaxel. So while castor oil has an important role in cancer treatment, it's not the miracle cure that some social media trends make it out to be. Its job is purely to assist in drug delivery, not to fight cancer directly. At the end of the day, cancer treatment requires evidence-based medicine, not viral trends. If you're considering using castor oil for any health-related purpose, especially during cancer treatment, always talk to your doctor first. The best approach to cancer care is one that is backed by science, research, and expert medical guidance, not internet fads. What do you think? Have you come across claims about castor oil and cancer? Let us know in the comments, and don't forget to share this with someone who might need the facts. Thank you for watching.